The opinions expressed in the Brothers-in-Law show are for informational purposes only and are not a substitute for personal professional legal advice.
Thanks for tuning in to Brothers-in-Law on Go Country 105. I'm Larry Mandel.
And I'm Rob Mandel.
And we've been trial attorneys here in Los Angeles for over 40 years.
On our show, we will discuss current events, talk about legal issues, and have some very entertaining guests stop by. So stay tuned every week for Brothers-in-Law right here on Go Country 105. All right, good morning, everyone. It's Rob Mandel with the Brothers-in-Law, and I'm here with my brother,
Larry Mandel. Good morning, Rob.
Hey, good morning. And thank you, Debbie, Mortgage Mom. We love coming after your show. You're just a lot of fun. And we really,
good stuff.
Good stuff, yeah. So, Larry, you know, in our daily lives, in our practice together, that we've been doing how many years now together?
Oh, my gosh, like 30 years.
Well, no, not 35, dude. Don't.
You are older.
Don't do that to me.
Yeah.
But it's more than 30. I think you're right, like 31 together. And we see a lot of bad stuff, you know, a lot of people.
Catastrophic injuries, stuff like that.
And including a lot of spinal cord injury folks, victims. And it's a hard thing to see. Yeah. But there are some heroes out there.
Yeah.
That help many of these people recovery and get out of pain.
Put them back together.
Right.
Yeah.
Putting Humpty Dumptys back together, getting back on their feet.
Yeah.
And we're fortunate.
Which is a segue to our special guest today.
Yeah, tell us about our special guest.
Our special guest is Anthony Virella, Dr. Anthony Virella, and he is a neurosurgeon, board-certified neurosurgeon.
Welcome to the show,
Welcome
Dr.
to the show,
Virella.
Dr.
Thank you,
Virella.
guys. Thanks for having me.
Hey, our
really
pleasure.
Appreciate it.
Our pleasure. So, a neurosurgeon, it just sounds like...
Sounds cool.
It sounds so cool.
Yeah.
And it also sounds like, you know, wow. You know, I mean, like, isn't that basically a brain surgeon, right?
It is.
Yeah.
It is a brain surgeon.
So when people say it's not brain surgery, you say...
It is.
It is brain surgery, exactly.
So,
exactly.
But it's also spinal surgery.
Right.
Yeah, there's a big component of the field of neurosurgery that is spine surgery. So it encompasses a very large piece of knowledge base for us. So by the time we're done with residency, the average neurosurgeon has probably done over 2,000 spine cases.
2,000 cases.
That's amazing. And
Yes.
how many years is school?
After 4 years of med school, the residency programs can vary anywhere from 6 years to 9 years. And then there's another, depending on your subspecialization, 1 to 2 years of fellowship afterwards.
That's super dedication.
Yeah, that's crazy, man. So where did you go to med school and all that?
So I went to med school in New York City at Columbia University.
Wow.
I got my MD.
Very
and then
impressive.
I did my my general surgery internship at the University of Pennsylvania in Philadelphia.
Okay.
And then I did the first part of my residency in Pennsylvania. And then I came out to do my chief resident year at UCLA Medical Center.
Wow.
Then after that, I went...
You went local.
Yeah, I was, kind of bouncing around.
And now you're in
right.
private practice.
And now I'm in private practice in Agora Hills and Westlake Village area.
And you're
Fantastic.
Performing surgeries in the local hospitals and things like that?
Correct. So we perform surgeries at several of the local community hospitals, and we also do a fair amount of our work in the outpatient environment in surgical centers, because spine has really changed over the last, I would say, 5 to 10 years, where the majority of the cases, because of the advances in the instrumentation, we're able to do a lot of these procedures as outpatient.
Because they call it, I've heard the term microdiscectomy. What does that mean?
So what has happened really over the last, I would say, 5 to 10 years is that the way that we approach the spine has changed, so that we're able to access the area without essentially making huge incisions. We're able to get to the area of interest with tiny little, almost like poke holes, and we're able to do our work through little telescopic ports. And then once we're done, we literally remove the port, and the patient has one stitch and a Band-Aid, and can go home, within
the
60
same day.
days.
So, but what gets us to that point? Because, we were talking about how we see so many folks with back pain, neck pain, and they've had a trauma, and now they're suffering, and not everyone is quote unquote a surgical candidate.
Correct.
So, and I know a lot of people, even if they are a surgical candidate, boy, they're scared blankless.
Absolutely.
They don't want to do it.
Yeah.
So, what
How
are
do we
the
get to that
criteria?
point?
Yeah,
Yeah.
what are we looking for that, that someone like you can come in and basically save the day for folks like this?
Yeah. So I think, the most important thing when you see a patient is to just talk to them and get a history, because the history will give you 90% of the diagnosis before you even do an exam or before
Really?
you even get a test. Yeah. I mean, really, the history tells you everything for the most part.
So good old-fashioned,
Just
face-to-face
old-fashioned
talking.
Yeah, just talk to them.
Yeah.
I think because of all the technology and computers and electronic medical records, I think, doctors are spending less time talking to people.
Right, which is not a good thing.
No, and they're spending more time on the computer without even facing the patient.
Yeah.
So it's very important to just sit down and just say, hey, what's going on? When did it start? What's going on at home?
Right.
How's your life? And get really a good history. And then after that, you do your examination. And then after the examination, you get your exams, MRI scans, CAT scans, blood work. And then you formulate an opinion as to what you think is going on.
Right.
And in my practice, we're always going to treat people conservatively first. That's the first step.
What does that mean, conservative?
We're going to basically try everything but surgery.
Okay.
That means physical therapy, injections.
Epidurals, observation, massage, acupuncture, chiropractic. So we have a lot of different modalities.
Drugs. Are there drugs that help?
I mean, drugs are important to a certain extent, but we try to stay away from just haphazardly prescribing, drugs to people. As we know.
They
then
just
they just
mask
get
the
it. Yeah.
situation, right?
Yeah, it's just
That's
going to
the
mask
opioid
it. And we have a huge
epidemic.
opioid crisis in the United States, as
Yeah.
you know. So we really try to be extremely conservative on that aspect of
Right.
treatments.
Doc, you mentioned epidural, so walk us through that. What is that all about?
So normally when I first see a patient, like you said, no one wants surgery. I mean, that's not the first step that people think about. But when I see the patient and they have, let's say, a herniated disc that's pinching the nerve, one of the first treatments that we will do is to try an epidural, what we call a transforaminal epidural steroid injection, which basically means that we're injecting numbing medication right into where the nerve exits. And hopefully that will reduce the inflammation and help the patient's leg pain.
And that becomes...
Well, I'm sorry, I stepped on you.
Okay,
But now I'm going to step right in.
No, let me just finish though, Rob.
Because
let me just
the
finish.
mind-numbing drug. I mean, the nerve, the nerve.
What happened to you here?
I think talking to you, it's like a mind-numbing drug.
Stop. Yeah. On the epidurals, it becomes therapeutic and diagnostic.
Correct,
right?
correct,
What does
Larry.
that mean?
So basically, the epidural
Had to get
will
that one
not only help the patient with their back pain, but it'll also help the doctor figure out where the pain is coming from. Because let's say, for example, I give you an injection at L4, L5, and you get better from it, then I now know that that's your pain generator source.
Right.
So that's your low
but is
back,
it-
L4,
Correct.
L5.
But my question was,
Okay. Go ahead, Rob.
is
You're
this
on.
like a temporary fix? Or can it be a more permanent fix for somebody?
Yeah, I mean, in my experience, the epidurals do tend to be temporary, but the time varies. They can last a week. I've also seen them last 8 months.
I see.
So it really just depends on the patient and how they respond to it.
Yeah.
I have a current client who it lasted about 6 months.
Yeah.
And then it seemed to come back again. And this was her mid-back area, the thoracic spine, which is kind of challenging, right?
Right.
Because it's an area that's kind of protected, and but it's also difficult to treat.
It is,
that
and
true?
it's hard to get to from a decompression standpoint because there's not much space in there.
We're Larry and Rob Mandel, the brothers-in-law, here on Go Country 105. Do you have a legal issue you need help with? We want to hear from you.
Find us on Instagram and send us a message. Then tune in on Saturdays at 8 a.m. right here on Go Country 105. Hey, if you missed any part of this show or you just want to hear it again, go to brothersonlaw.com for all of our previous shows and all things Brothers on Law. What are we talking about when we talk about most of the time when someone has a really bad back injury or neck injury? What is going on? Anatomically, physically, what's going on?
There's a lot of different things that can occur. I mean, I would say that the majority of the time, the problem is a herniated disc, which has shifted out of its location and is now pinching the nerve.
Okay.
That's probably 80 to 90% of the time, whether it's in the cervical spine or the thoracic or the lumbar spine. That's what we're seeing. So what happens is that the jelly that's inside the disc will leak out. Almost like when you squeeze a toothpaste tube.
Right.
And
Like a jelly donut.
The stuff comes flying out, right? Imagine trying to put that stuff back in. It's impossible.
Yeah, it's not going to go back.
It's not going to go back in.
You can't put the toothpaste back in the tube.
You can't.
Yeah. Yeah. So now, and by disc, what you're referring to is that much softer or like a kind of rubbery material in between your vertebrae bones.
The bones.
It looks like crab meat.
It does.
It looks like crab meat.
Wow.
Yeah.
But it doesn't taste as good.
No, it doesn't. No,
Yeah,
but
yeah.
it looks like it.
How do you know, Rob?
I eat plenty of disc. Yeah. So,
All right. So then, what do you do after that? You've diagnosed that condition.
Yeah, so basically once you see that the disc is herniated, and we were talking about traumatic forces that push this disc out of its location, usually through what we call an annular tear, which means that the covering of the disc has ripped.
right.
So the first line of therapy is always going to be to observe the patient.
Right.
That's the first line. Just give them a few weeks, see how they do. If that doesn't work, then we'll proceed to epidural injections like we spoke about, or we'll do physical therapy. We will try chiropractic. Some patients have done well with acupuncture techniques.
Yeah.
So there's a lot of different things that we can do, before we just jump to surgery.
A lot of options, although if it's really bad, there are cases where it's just, it's just not going to help. It's going to be a Band-Aid on a major wound.
Totally. And if, the patient has tried everything, we've done everything, the patient is months in and still, complaining of pain and it's affecting their life. That's really how I talk to the patient. I ask them, let me ask you, is this affecting your life, your activities of daily living? If the patient says, yes, I can't live my life, then that's usually a patient that's going to do well with surgery.
And just so we are clear on what is going on for the most part when you have like a herniated disc, it's not just local back pain, is it?
No.
Tell us about that.
It's back pain, but it's also pain that's coming from the fact that the nerve is pinched. So when the nerve is pinched, now you're going to get pain either going down the shoulder or the arm or the leg.
Right.
So it's essentially back pain plus shooting leg pain, or what we call radiculopathy.
Right.
And in the low back, it would
Which
go
is
down your
ridiculous.
legs.
Correct.
Yeah.
And in your neck, it would go down your arms and your shoulders. And
Correct.
that's called the dermatome, right? The
Correct.
path.
Correct.
But I've had people tell me, yeah, man, my whole leg is killing me at my foot. And then we trace it back, and it's coming from their low back where they have this disc.
And sometimes, Dr. Virella, you could have the pain or numbness going down your leg, but your back doesn't really hurt.
Yeah, that
right?
can happen as well.
But you still got to go into the back to fix that.
Yeah, I mean, the way I look at it, and I tell the patients, you have a pinched nerve. We just have to unpinch it.
Yeah.
That's really what you're doing.
Right.
It's not magic. You just taking the pressure off of the nerve.
Yeah.
And how
Makes
long
sense.
is there a certain time period for these surgeries? What's the minimum and the maximum, it seems like?
It depends on the patient's status. I mean, if the patient has, for instance, say something like a drop foot, which is a neurologic deficit, then that's a patient I would probably take to surgery sooner than later, within a few days.
Because it could end up being a permanent problem.
Yeah, because if
right?
someone
Get
has
worse.
a neurologic deficit, that's evidence of nerve damage.
Yeah.
The nerve is damaged,
And it won't recover?
It can recover, but you need to get to it in an expedited fashion.
Yeah.
Because the peripheral nerves actually do recover. So we have that luxury of being able to actually see the nerve resprout.
Really?
Yeah.
Okay.
Yeah.
Well, that's good to know.
Yeah, I didn't know that.
Resprouting nerves.
Yeah.
Yeah.
Yeah. But why should or shouldn't somebody fear surgery?
You mean the risk involved?
Well, no, I'm just people are afraid. I mean, I don't know if they know about risk or they don't know about risk, but why should they fear it and why should they not fear it?
Good
Yeah.
question.
Yeah, I mean, I think when someone is recommended surgery, I mean, I think it's reasonable to get a second opinion and just see what another practitioner opines on the situation. But I think, the red flags for me is a doctor who just recommends surgery right off the cuff without trying any conservative therapies. That's probably someone that you should really look hard at seeing someone else. Because most prudent physicians and surgeons will try to treat the patient non-surgically first. And that's the standard of care.
Is that because once you go in, no matter how good the techniques are and how modern they are now, that you're still kind of altering the what's the word?
Anatomical?
The anatomical configuration of the spine to some extent.
Yeah,
or whatever.
And the way I
Anatomy.
see it is,
that was the word, anatomy.
the way I see
Bingo.
it is, once you do it, you can't undo it.
Yeah.
So you really want to make sure that the patient has tried everything they can.
Right.
And that's for me the sign of a patient should feel comfortable with the physician if they've tried everything.
Right.
And now they're sort of 6 months out and they're still in pain, and the doctor says, "Okay, well, let's start talking about surgery." That makes me feel much more comfortable than someone who just jumps right in and has a knee-jerk reaction.
Yeah.
You need surgery.
See, in some of our cases, there will be conservative care, and they may see a specialist like you, but then there's a gap, maybe a 6 months or a year where they really don't do anything. And then they're
just trying to grin and bear through it.
But in our world, they're highly criticized. Oh, there's a gap in treatment.
Right.
What happened there? But you see that quite often, right? For those same reasons.
Yeah, we see that. I mean, people have complicated lives, and sometimes they're busy with kids and with work and their families, and they neglect themselves.
Yeah. And don't most people, they just want to keep living. They don't want to have to stop and go to doctor after doctor and maybe, try this and try that. They just want to get back to normal.
They just want to feel better.
Yeah.
People just want to feel better. That's it. Most patients say, "Doc, I just want to feel better. I don't care about anything else."
Have you suffered or been injured by someone else's negligence? When you need a legal team that will stand up for what is right, won't give up the fight and obtain justice, call 818-886-6600. Mandel Trial Lawyers specializes in personal injury cases of all types. Whether it's a car accident, product or premises liability, dog bite, or a catastrophic injury, Mandel Trial Lawyers are there for you when the fight is worth it. Call now for your free consultation. 818-886-6600. Let the scales of justice tip in your favor.
So by the time you get to the point where you are really considering surgery, and you as a doctor are saying, yeah, maybe we should consider that, they're really at a point where they
turning back.
Well, they just can't have a normal day without being in pain. The pain is just taking over. It consumes
their lives. Yeah, and then they're not thinking about anything else, but just how they're going to deal with the pain all day.
Are there any new techniques on the horizon?
Yeah, I mean, a lot of the new technologies surround minimally invasive access, and also stem cell therapy is also something that's in the works, and it's being tried in some centers. But also there's different radiofrequency techniques, rhizotomy procedures.
Oh yeah.
But mostly a lot of the techniques surround access and literally trying to get to the spine with the least incision possible.
That makes sense.
Yeah.
The rhizotomy is like where they burn the nerve, right?
Yikes.
So, rhizotomy is a procedure which is similar to an epidural, but instead of injecting numbing medicine, they have a needle and they heat it to 90 degrees. And it doesn't hurt, actually, but what it does is it deadens the pain nerves that are going from the spine back to the brain.
Right. Yikes.
And that I've had very good results with
Yeah.
And
but I would want to be asleep.
Though?
I would not want to be awake.
Well, most of the time you are asleep when they're doing it. It takes 15 minutes, but those can last
You're
up to
brave,
a
bro.
year.
I don't want no 90-degree needle going in me while I'm awake. Yeah. Right.
And how long does the effects of the rhizotomy?
Rhizotomy, they can usually last about a year. and then you can repeat it.
I see.
So it buys the patients additional time when they're trying to avoid surgery.
And so when you see a patient that you had the rhizotomy performed, and do you see them like just with big smiles on their face?
Oh,
like
yeah.
A whole different world for
Totally
them?
different person.
Yeah.
Yeah.
Nothing like pain to completely stop you cold.
Yeah.
You know, and everything becomes about getting out of pain instead of, hey, I'm just going to go take my car to the car wash or
have go
pick
on
up the
vacation.
kid. Anything.
Yeah, I mean, you can have let's face it, you can have all the money in the world. If you're in pain, your health is compromised.
You are very poor indeed.
Boom. Yeah,
absolutely.
And by the way, folks, if you've had something like this befall you and you want us to check out your case or even put you in touch with someone like Dr. Virella, you can call us anytime at 818-886-6600. That's our number.
Yeah, 818-886-6600.
Just call. I just told them the number.
I want to tell them again. But
anyway,
you know what? I want to hear Dr. Varela. How do they get in touch with Dr. Varela?
So how do they get into? Well, besides call, because we will put them in touch with Dr. Virella as well. But how can? Don't you normally get a referral from a different kind of physician, or can people directly contact you?
I usually get referrals, but also I'll get referrals from other doctors and from attorneys as well. So my office is in Agora Hills. And
what's the number, Doc?
My number is 805-449-0088.
Can you say that one more time?
Yeah,
there you go.
805-449-0088.
Perfect. Well, we have a caller on the line, so we're going to take this call and see what it's all about.
Hey guys, this is Brandon. I love the show. I was recently in a bad car accident and the other driver admitted fault. I sustained some serious injuries and the doctors told me I may miss up to a year's worth of work with all the rehab. Is it possible to be compensated for pain and suffering? How's that figured out? Thanks, guys.
All right, Larry, what do you want to say to Brandon?
Oh, yeah. I mean, if you're in an bad auto crash and and the other driver's admitted fault, gee, are you entitled to pain and suffering? Of course. And that's called the non-economic losses. And that includes not only just pain and suffering, but inconvenience, fears, anxiety, and things of that nature. What are your thoughts, Rob?
Everything that is not, computable on a calculator is a non-economic loss. So, loss of enjoyment of life, fear, humiliation, anxiety, worry, the pain, the suffering, because everything that when you have a bad injury like that, everything, like we were talking before, everything comes to a blinding halt, and you're utterly consumed by it, and that has a value from a legal standpoint. It has a value. Now, he's asking, hey, how do you figure that out? Well, for the most part, we look at if we're trying to resolve the case without having to go to trial. We're looking at other trial results, and we're looking at what juries have given for those kinds of pain and suffering. But if you go to trial, then it's up to a jury, and they're going to figure it out for you, and we're going to give them guidance.
Yeah, because there's no set formula. Excuse me, Rob. There's really no set
formula.
Right.
Excuse me, Larry. I'm just kidding you. But it is kind of a tough thing, but generally speaking, we consider the value of someone's non-economic losses to be far in excess of their out-of-pocket stuff, of their bills, of what it's going to take to have a surgery and whatnot. Because you only have one life, man.
That's right.
You only get one go around, and when someone,
at the hands of another,
if someone else's carelessness puts you in that position, and you're talking to Dr. Virella about, hey, man, how do I get out of pain? How do I get out of pain? And now we're going to have surgery. That's a tough place to be, right, Doc?
Yeah. It's the patients, like you were saying, they come in scared. They're coming to see a surgeon, and I think people automatically think, hey, this guy's going to
want
to cut me.
Yeah.
He wants to do surgery, but really that's not what we do. at the practice. I mean, I operate on 10% of my patients that come in through the door.
Oh, that's
so
good to know.
you're able to find other solutions
Yeah.
for the 90%.
The 90% of the patients are not getting surgery. You know, they're being referred to pain specialists or chiropractors or physical therapy, or sometimes people just need spine surgeons to just follow them,
Right.
to monitor their care, to come in and talk to me every month and see how you're doing.
Yeah.
It's not just about, putting someone on the table and cutting. I mean, that's not what we do.
Right.
There's an art to what we do, and it's a lot of it is just managing the patient's total care.
Well, what you were in the very beginning of our conversation, you were talking about, what it takes to become a neurosurgeon. And you were talking about basically a 10-year path, right?
Right, correct.
So from the time you say, okay, I'm in medical school, yay, I got in, I'm Columbia, so I'm creme de la creme from that standpoint, right? But now you're on this path and you are sacrificing so much of your own life really to get to where you're
and that's
you're gonna go.
It's funny you should mention that, because you were talking about you only have one life.
Yeah.
So to become a neurosurgeon, I didn't get out till I was, in my mid 30s.
Yeah.
I didn't live my life. I was in almost my late 30s.
But you know what's refreshing?
In books and
Just
in clinic
in books and seeing patients
and doing and performing surgeries.
I mean, I've probably at this point have performed over 13,000 surgeries.
That's the
amazing.
kind of doctor I want. But you know what kind of doctor I also want is like Dr. Virella. He's got compassion.
He does. He talks to his patients.
Yeah. No, and he's a listener.
Yeah,
right.
that's right.
It's so important.
Unlike my brother, but no.
But it's unlike a doctor that comes in and like, what did he say? Where's she going? What happened? I don't even know what she's talking about.
No, I'm not. Actually, Larry's a very good listener.
Thank you, Rob.
I'm just
Thank
busting his chops.
Yeah, that's what I'm here for.
Yeah. No, but you are a good listener, and he's listening to us ramble right now.
Yeah.
And,
well, it's brotherly love.
Yeah,
kind of.
He's got a big smile on his
Yeah.
But
So I love the fact that Dr. Virella is in his scrubs today, because
he is.
on a
He ran.
Saturday he saw
He
patients.
ran
That's
over
right.
here.
Yeah.
I did.
From a surgery. What surgery were you doing? What kind of surgery?
Well, I was seeing patients this morning.
Oh, okay.
It's post-operative surgical patients.
Yeah.
I was literally rounding this morning. I got in my car, drove on the 101, and here I am.
Wow,
I love it.
And what are the gamut of surgeries that you do to the spine? What like from the most simple to the most complex?
Yeah, so we'll do anything from cervical surgery, discectomies, anterior fusions, Chiari malformations, which is a condition where a piece of the brain hangs into the spine.
Oh my gosh,
never heard
and
of that.
And you have to
I would
make
not want
space for it. No. So we do thoracic surgeries and discectomies and fusions, and then
That's
all
with hardware, right?
Correct.
Yeah.
And then obviously the lumbar surgeries, which include discectomies and fusions, but also a big part of our practice is also repairing injuries, fractures.
Right.
So
Trauma.
fractured in the spine?
Yeah, so a fracture in the high cervical spine or the thoracic spine. We do a
Dangerous.
lot of it's almost like working with an erector set.
Yeah.
Putting people back together.
Were you good at doing that as a kid?
Yeah, I
Because
was good.
It's very
I was good at
delicate.
Legos. And
So you out there that have kids that like Legos, you never know. They may
Yeah.
become a neurosurgeon. Keep your
Right.
fingers crossed. All right. So I guess, Rob, we're kind of running out of time here.
Well, do we have time for a true or false?
Yeah, let's do it.
So, what do you think? Is it illegal to transport an animal in the bed of an open air truck?
Open air
So
truck.
in other words, you got a flatbed truck or like a Ford 150, and there's your dog back there. Is that illegal?
I think it should be. I'm in California. I don't know, but I think it should be.
Hey,
Yeah,
our producer
it's true.
Cam says that
You
is
didn't
true.
ask Dr. Varela.
Doesn't it depend on the state? Because I've
can't do
seen
that.
sheep like in Arizona.
Oh my God, I'm sure
Sheep
they
in the
just,
truck.
Yeah, they just herd them anywhere
That's
they want.
bad. No, no.
Oh, good one.
Thank you.
All right. Well, it is time to wrap up. I'm sorry to say we've had a lot of fun with Dr. Varela. And again, we want to thank you for taking the time to come down here, Doc.
Oh, thanks for having me.
Yeah.
Yeah.
So we really enjoyed having you. And
if you missed any part of the show,
if you
you want
missed
to
any
hear it
part of the
again,
show.
or want to listen to our previous shows, go to brothersonlaw.com for all things Brothers on Law. And to all our listeners, thank you for tuning in, and check out next week's show at the same time, 8 a.m. on Go Country 105. And Rob,
And
what are we going to remember?
to let the scales of justice tip in your favor.
The opinions expressed in the Brothers-in-Law show are for informational purposes only and are not a substitute for personal professional legal advice.